but we are delighted to have with us. She started her role on Valentine's Day. It's a love affair. It's a love affair with Healthwatch for Louise Ansari, who started, as I say, on Valentine's Day this year. And I'm going to be speaking towards one of my colleagues, I know, ex-colleagues, who has hearing difficulties. So if any of the other speakers, just bear in mind that some people can't hear. We don't have text to, or speech to text going up. So just speak clearly, look at your audience, and then most of it will be picked up, I'm sure. So Louise started on Valentine's Day. She's strong background in health communications, social policy, and local services. And for the past 5 years, she's been director, or she was director of communications, influencing at the Centre for Aging Better. I better talk to her about that later, because I need to know all about that. And previously, she's held leadership roles in Diabetes UK and on Lambeth Council. So please put your hands together for Louise Ansari.
Thank you so much, Jeffrey. And morning, everybody. Cool. Great to be here today. And thank you so much for inviting me, and thanks for organising it. I'm sure it's going to be an absolutely fantastic day. And it's a real pleasure and a privilege to be the National Director of Healthwatch England. Now, a key part of my role is to support local Healthwatch. So I'm spending lots of time at the moment, whilst I'm still in the kind of immersion phase of my new job, meeting lots of Healthwatch staff and volunteers and the partners they work with in the voluntary and community sector and in the health system all around the country. Of course, I am also here today as a Sussexonian. I'm not sure if that's a word. Is it a word? Somebody who lives in Sussex. So I live near Wadhurst, in Wealdon, near the border of Kent, and Sussex is such a beautiful area, isn't it? I also have the privilege of being a designate non-executive member of NHS Sussex, which is the Integrated Care Board. And Stephen, we now only have 2 days before the launch, and we can stop saying the word designate, which you've been saying for the last 8 months or something crazy. So, but obviously today I'm here as the National Director of Healthwatch and supporting you and looking forward to the discussions. Now I'm going to talk broadly about 4 things this morning. Firstly, the immense value that Healthwatch brings to the system, highlighting patient, public and community views, as well as remaining independent and holding the system to account. Secondly, the ongoing task of Healthwatch in embedding patient and public voice to deal with the challenges that we face in Sussex and of course in Kent and Surrey over the next year and beyond. Thirdly, the underpinning need for collaboration, governance roles and resource needed for Healthwatch and the wider voluntary and community sector to work effectively together with the system across the patch. And then lastly, the bigger strategic opportunity that integrated care systems bring, where Healthwatch and the wider voluntary and community sector can work with and as part of the integrated care partnership on the wider determinants of health, on social care and on reducing inequalities. So let's begin by reflecting on the fantastic work that local Healthwatch have done recently in this area. And I'm going to give 4 examples, but there are many, many more, and I'm sure you're going to be hearing many more through the day. I know most people are from Sussex here today, but I'm also going to mention 1 or 2 from Kent and Surrey. Now, in Kent, the Healthwatch and the Kent Community Foundation Trust highlighted the difficulties people from the trans and non-binary community, it's around 17,500 people, had in accessing emotional and mental health support. People felt their GP had not listened to them, and not understood them. They needed more emotional and mental health support. There was a real need for improved awareness and understanding amongst professionals. Long waiting times had a really poor emotional impact on people's mental health. And there were issues around the availability and accessibility of services with gaps in specialist support. Healthwatch called for more proactive and tailored services, as well as support for people who were waiting for an appointment with the Gender Identity Clinic in London. And they asked for a feasibility study for a gender identity clinic to be created in Kent. They really raised the profile of this group of people and really raised the needs of this community. They had clear recommendations on what the health system should do. So particularly in Pride Month, I'd like to say thank you to Healthwatch Kent for raising the voice and ensuring that group of people have been listened to. Now, Healthwatch Surrey worked with local dementia support groups and partners across Frimley and Surrey Heartlands ICS, including the Surrey and Borders Partnership and Surrey County Council, to feed into the development of a new joint health and social care dementia strategy. Our colleagues brought the experiences of people with dementia and their unpaid carers to the forefront of the Dementia Strategy Action Board and outlined what could be done to fix care with a clear focus on tackling inequality. As the number of people with dementia increases, particularly living in the southeast, Healthwatch with partners continue to spread awareness of the actions people can take to prevent dementia and how the system can diagnose and treat dementia faster and better. In Brighton and Hove, anybody here from Brighton and Hove this morning? Hey! In Brighton and Hove, our Healthwatch and partner colleagues designed a wellbeing service for people when they get home after a stay in hospital. The service offers a specialist local knowledge to enable referral to local services, for example, food and medicine deliveries, or financial advice, information, and support to reduce loneliness and social isolation. Links to organisations that can support people to improve their health and well-being, and signposting people to organisations that could provide specialist advice on benefits. The success of this service, of the service that you created and have run, has been really recognised and appreciated, and there are plans to extend it to other areas of Sussex. So that is absolutely fantastic work. Healthwatch in Sussex have collaborated with colleagues from NHS organisations, local authority adult social care teams, public health teams, adult safeguarding teams, the Care Quality Commission, residential care home providers, carer support organisations, and residents associations on their Staying Connected in the COVID-19 Pandemic series of webinars. They successfully amplified the voice of family carers and relatives on the need to stay connected with their loved ones in care homes during the COVID-19 pandemic. This was a fantastic way to provide those with lived experience with a safe place to share their views and feedback and build a constructive dialogue. I attended one of those webinars. It was back in, when was it? November 2020, I think. It was absolutely fantastic. There were around 90 people on it. And it was immensely helpful to everybody who contributed and listened. So those are some of the examples, and those examples are really indicative of what I would call the USP of local Healthwatch. You give a voice to people who are not being listened to well enough by the system. They're not being well served. And local Healthwatch ensures that they're heard and that they receive better care and treatment. This happens across the breadth of England. In doing this well, Healthwatch and other partners are reducing inequality of access and therefore inequality of outcomes. Now, this doesn't have to be a complex or lengthy process. I was in Blackpool a couple of weeks ago with Healthwatch colleagues, and we visited a daycare centre for older people and people with learning disabilities. We were asking about people's views of the centre, and they were a really lovely group of people. They said, the food's amazing, this daycare centre, we really love it. The staff are fantastic, the activities are great. And actually, whilst I was there, there was a lady doing a session on armchair yoga for the residents, which was really good fun. And when we asked what could be better about the service, one gentleman who's a wheelchair user said that his home care only included bed washes. And he used to be able to get a shower at the daycare centre and to be supported to have a shower, and that the showers were set up with hoists, excuse me, and the equipment for him to be able to have a shower. And he was asking if the shower room could be opened again. So it was a really simple question. What could be better about my care? And a really simple answer. It would be great if I could have a shower. Now, the impact of asking those simple questions and sometimes getting quite simple answers is quite profound, isn't it? And actually could improve the quality of life of somebody immensely. So the work that you do and the work that we do in continuing to ask those questions is so incredibly important in terms of the quality of life of people in this country. And there are thousands of examples like this that add up to a much deeper understanding and relationship between health and care services and the communities and the individuals they exist to serve around the country and in our patch. So I will come on to the next part of my talk today, what the world looks like now and the developing role of local Healthwatch with partners taking up opportunities and helping to resolve challenges that we face across Kent, Surrey and Sussex over the next year or so. Now, after a recent media report, naming no names, a colleague in the NHS said to me, "You're not still banging on about dentistry, are you?" I know they were joking, but yes, we are still banging on about dentistry and access to GPs and waiting times and the experience of people whilst they're waiting for treatment and the difficulty young people and people of other ages have in accessing mental health support and people with long COVID not getting the care they need and people not being discharged from hospital in the way that's best for them. And fundamentally, the inequalities in access to care and health outcomes that many groups suffer. I am afraid that we at Healthwatch England and local Healthwatch will keep banging on about these issues until they get significantly better. These issues are all live across Sussex and Kent and Surrey, and there are also going to be specific areas where local Healthwatch will bring patient and public views in that are very specific to our geography. On, for example, the service reconfigurations for stroke, ophthalmology and cardiology in Sussex, and the capital developments like the new hospital we will hopefully have managed by the East Sussex Hospital Trust. But we're not here actually to complain from the sidelines. We're here to help support redesigned services. We're here to help embed people, patients and communities right at the centre of improvement. So all colleagues here from the NHS and from local authorities, Healthwatch may sometimes be critical, but we're also always there to support change. That's what we're here to do, to work with you to make health and care better for people. In order to be able to do this effectively at a system-wide level, so at an ICS level, as well as place and neighbourhood, there is an underpinning need for collaboration, capacity to take up governance roles, and resource needed for Healthwatch and the wider voluntary and community sector to work effectively together in the system and at place. And I'm sure that Stephen and others understand this and are already showing their commitment, including indeed by part funding this event, which is all about collaboration. I'm going to end by talking briefly about the bigger strategic opportunity that the integrated care systems bring, where Healthwatch and the wider voluntary and community sector can work with and as part of the integrated care partnership on the wider determinants of health, like housing, like employment, on the nexus between social care and healthcare, and on reducing inequalities. So we're all good in the voluntary and community sector and in local Healthwatch as seeing people as actual people, not as long waiters or patients with multi-morbidity or members of a vaccine hesitant group, but actual people with a range of needs. I think the NHS, which is full of amazing people as well, by the way, sometimes forgets that people are not a collection of health conditions, and that sometimes people with bigger problems in life may not put their health first. If, as the cost of living crisis really bites, you can't afford to feed your family, you'll probably do some extra hours at work. Oops. Small spillage. Are you okay? Great. Oh, the table's collapsed. You okay then? Right, I will carry on. I've only got another minute or so to go. So if the cost of living crisis really bites, you can't afford to feed your family, you probably do some extra hours at work rather than go to a screening appointment. If your pension's not going very far these days, you might not fix the leaky window in your house that's causing mold to grow on the walls. And if you've arrived here in the South as a refugee, learning English to be able to translate health information or letters from your GP might not be the thing that you spend all your time doing. I'm optimistic that closer working between all system partners will start to extend our idea of how we care for people and our ability to care for individuals according to their needs. This will mean more preventative work together, including supporting better housing, employment, education, and skills in the region. It will mean understanding our populations really well and personalising care as much as possible. Again, this is where local Healthwatch and the voluntary and community sector really come in. We need to be integral to those discussions at both a strategic and a practical level. What are people's needs? What are their barriers to getting care and treatment? How can the system help remove those barriers? How can people, patients and communities design new ways of support jointly with system bodies? So I'll end on that question and challenge, and hopefully that note of optimism that our future working as part of new integrated systems will be really better for public, patients and communities. Thank you very much, everybody.